The National Health Insurance Authority Act signed into law is seen as a game changer in the healthcare delivery system in Nigeria. When implemented, the provisions in the Act can reposition the health sector as well as give access to healthcare to every Nigerian. But how are stakeholders reacting to this, especially health maintenance organizations who are directly affected by some provisions in the new NHIA Act? What are their reactions? Will the provisions affect their operations or effectiveness? So many questions are coming up. In this episode of the program, we shall be talking with Dr. Kolawale Owoka, MD, CEO, United Healthcare HMO, one-time president of the Association of HMOs, and a key stakeholder in the health insurance process. My name is Aisha Muhammad Ahmed, welcoming you to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Authority as it drives Nigeria towards universal health coverage. Please stay tuned for the full program right after this timer.
President Muhammadu Buhari has signed the new NHIA Act into law, which makes health insurance to be mandatory in Nigeria.
One of the reasons why we decided to gather here,
familiarize ourselves with the contents
of the Act, is entirely a watershed, a new beginning.
It's going to be a transition between the National Health Insurance Scheme to the National Health Insurance Authority.
And then start preparing for how we are going to implement it.
First on the program is a highlight of events around the NHIA. In the news, DG NHIA says Nigeria is marching towards self-reliance in healthcare delivery. In other news, the National Health Insurance Authority collaborates with journalists in Edo State to spread the news of easy access to healthcare for all.
The Director General and Chief Executive Officer of the National Health Insurance Authority (NHIA), Professor Nasir Sambo, says with the signing of the Mandatory Social Health Insurance Act by President Muhammadu Buhari, Nigeria is now marching towards the attainment of self-reliance in healthcare delivery. The DG CEO made this known at the 16th Annual Scientific Conference and All Fellows Congress of the National Postgraduate Medical College of Nigeria held in Lagos. Professor Sambo added that within the Act, President Buhari has alluded to the fact that his administration is going to ensure that 83 million vulnerable settlements are paid for within the national health insurance programs. This, according to the NHIA boss, can bring down the high level of catastrophic expenditure that Nigeria is grappling with. He speaks further on what the Lagos conference should address.
So ladies and gentlemen, as we are listening and packaging all this discussion, we need to sit down as a college and look at the healthcare system in total and see how we can develop a very comprehensive reform that will cut across our primary system, secondary system, and tertiary system. Only by doing so, we will showcase that we have a capacity to bring a lasting problem or a lasting solution to the healthcare delivery system.
Professor Sambo noted that there is need for aggressive reform to ensure that Nigerian teaching hospitals and tertiary hospitals are repositioned in a way that they can stop medical tourism abroad. In a bid to ensure affordable health care for journalists in Edo State, the Nigerian Union of Journalists (NUJ) Edo State Council has agreed to collaborate with the National Health Insurance Authority to provide awareness and enlightenment for health insurance programs. The agreement was reached when members of the National Health Insurance Authority Edo State paid a courtesy visit to Edo State Council of the NUJ. Speaking at the event, Barrister Ohomba Uyi, Edo State Coordinator of the National Health Insurance Authority, said the visit was to seek partnership and collaboration in the area of awareness and publicity. Responding, Comrade Festus Alenke, Chairman Edo NUJ, appreciated the NHIA for the visit and also pledged support to the NHIA. He said there's the need for journalists to be insured because of the risk they encounter in the course of discharging their duties. He further urged the authority to monitor designated hospitals where enrollees go to access care.
If you are just joining us, the program is Easy Access to Healthcare for All. The NHIA maintains a tripartite relationship in the process of its operations, where it relates with the healthcare providers as well as health maintenance organizations who are the middlemen between the authority and the providers. The new Act, however, introduces new provisions that affect its operations as well as structure. One major stakeholder affected directly is the Health Maintenance Organization. How are HMOs reacting to the new Act and the changes it brings to the delivery of health insurance? Let's find out in our next segment, Issues Around the NHIA.
The health maintenance organizations serve as middlemen in the health insurance process. They not only carry out payment to healthcare facilities, but they are responsible for issuance of referral codes when NHIA enrollees need secondary care. HMOs also carry out standards and quality assurance on facilities and so many other functions, partnering to improve the delivery of health insurance to Nigerians. How are the HMOs reacting to the new NHIA Act? Dr. Kolawale Owoka, MD CEO, United Healthcare Maintenance Organization, registered under the NHIA, says the new Act is a long-awaited move that will change the face of the health insurance ecosystem.
This Act is what we've been waiting for since 2005. Because when NHIS was launched that time, people were worried that why was it not compulsory? This is a nation of 200 million plus. The only way to get them in is to make it mandatory. And then let me tell you, sometimes it's good to learn from behind. You will not believe it that health insurance started in 1883 in Germany, and it was because that the chancellor at that time made it compulsory. So if some countries can make something compulsory in 1883, can't you now see that Nigeria, if we are really serious with our health and we want to reverse this tourism, this is the way to go, and we are happy.
The new NHIA Act makes health insurance mandatory for every citizen. So, what is the place of the health maintenance organizations in the implementation of the mandatory health insurance?
Very easily, federal government started out in the formal sector, enrolled their staff and so on. So they now said, okay, you can now go to the rest of Nigerians. For the companies who are doing fine, we find it easy to bring them in. But for the companies who don't want, there's nothing you can do. But when it is mandatory now, they have no choice. We will go there, collect their premium, enroll them. So definitely it will increase enrollment, and that is our job. And then the sensitization too, we make sure it increases, because this is the time to let people know that the HMOs are even to do customer care for them. If they have any problem, we will monitor their utilization in the hospital, we monitor the quality of services they are getting, and we help make sure that they get customer satisfaction.
With the mandatory nature of the law, do health maintenance organizations have the capacity to handle the pool crowd and also be able to monitor the healthcare facilities as well?
Definitely, they will be, because a structure has been laid. You know, initial when you want to start a program, the first step may be the hindering step. Once you can make that first step, and then you can recognize it and then make sure that the structure, the processes are okay, the outcome will be all right. So the ground has been laid. We now know how much they pay per person. We now know how much premium. We now know how much we pay the providers. We have finished all the problems around all those. They now know how much they pay the HMO. They now know how much they pay for fee for service. They now know how much they pay for capitation. And you can descend on whoever has not paid this one. So the structure is now on the ground and we should just be flying on.
Fundamentally, the new act puts the responsibilities previously handled by the health maintenance organizations to the NHIA. One wonders how this will affect the operations of the HMOs now.
Honestly, it will not affect us much because all stakeholders have now realized that for the scheme to move forward, we all must gather together and do strategic planning that will involve everybody, and everybody must be taken into account. So we are going to tell them, this is our part, this is how much we have gone in private sector, and you cannot, whatever you are doing, private sector is the engine, and they must still be involved. So there's no way they can come and say, because the law makes it compulsory, there will be no private sector. No, private sector will still continue to be booming. We just need to see how to accommodate the NHI's basic plan along with the private sector.
There has been some contentions around the roles and responsibilities of the authority before now, but the new law categorically states that the authority should regulate, promote, and to integrate. What does this mean to HMOs?
The objectives are very good, and as I've told you, if you go back a bit on the history of other countries, look at it gives them more power to shape the destiny of the health of Nigerians. And this is what every Nigerian has been yearning for, that look, our health should be total. It should not just be curative. It should involve prevention. It should involve prevention and wellness and every other thing. So there's no limits to it. So if we are really serious on reversing medical tourism, let it be total. Everybody, every Nigerian, poor or rich, needs health. And therefore, if you are to serve 200 million people, they need such powers. Even among us, HMO, sometimes we see some people who want to bring out plans that may not be appropriate. The NHIA now have the authority to approve your plans and make sure that before you go and market it to the people, it is approved. So that means somebody is there for the average Nigerian looking at what they will be offered.
As a key stakeholder in the health insurance space, Dr. Kolawale suggests ways that will help make implementation of the provisions of the NHIA Act seamless.
They need now to roll out what we can call blueprints. Roll out blueprints for the whole country. Then liaise with the government officials. Look, this thing needs to work. Government the law is out. We now need to make it work. And then let them also help use what other countries have done to get forward. Take Finland, for example. In 1930, they had the worst maternal mortality in Europe. But by 1949, the first thing they did is a lot of sensitization to make sure that all deliveries are done in the hospital, no longer delivery at home. Then how do? You have to encourage, you have to put in work to encourage people to do that.
Welcome back. Easy access to healthcare continues with our stakeholders segment, and in this episode, we shall be talking with Dr. John Onyeokoro, Executive Secretary, Imo State Health Insurance Agency. He begins with his standpoint on the new NHIA Act.
I think everyone agrees. Everyone agrees, and I'm also in agreement that it's an excellent piece of legislation. It's a law whose time has come because it has been long overdue. And this is what we need now to drive towards universal health coverage, because essentially it makes sure that health insurance is compulsory.
Does this new act apply to states? And what are the advantages for them? Dr. John explains.
We are going to key in, simply we'll key in, just like every other state agency. We'll key in because it is an expression of what we could not achieve individually and collectively in all the states. So we'll all key into it. Well, there'll be greater collaboration now. There'll be greater collaboration because we will have more synergy and we will have some interoperability in key areas like ICT. So it's quite a welcome development.
The NHIA Act stresses mandatory health insurance for all Nigerians. Dr. John explains how that can be attained.
Well, it's not going to be easy because it will involve a lot of orientation and reorientation. But I think it's simple in the context of the fact that in principle, you ask yourself, when you drive your car, you're required to get insurance, is that not so? Now, if you don't get the insurance, you're liable, you're committing an infraction. In terms of health, there are even more innovative ways of enforcing it. For instance, you can make it possible that if you don't have insurance, you can't even enroll your child in school. If you don't have insurance, you can't do government contracts. If you don't have insurance, you can't undertake certain public sector services that you would have wanted to do. So implementation modalities are diverse and it could be worked at.
The CEO of the State Health Insurance Agency explains the implication of the provisions of the law that bestows the NHIA with the responsibility of regulation, promotion and integration.
Well, it means promotion means that you try to carry on activities that will increase awareness of the population to health insurance. So even you, the media, will be involved. Integration means that they will bring together all the various efforts by the various subnational components into a holistic part so that they can have a synergy. For instance, the enrollment figure in Zamfara, assuming somebody enrolled in Zamfara and he visits Owerri and he falls sick, when you have integration, the person should be able to receive service in Owerri, though he enrolled in Zamfara. That is integration.
Stakeholders have stressed that the Act is a medium that will hasten the attainment of universal health coverage by the year 2030. Dr. John shares his thought on that.
To the extent that it will make more people now buy into health insurance, it will make more people enrolled into health insurance, that it means that more people will now have access to health. When more people have access to affordable and equitable health, then you are promoting universal health coverage. And the premise on which this is established is the compulsory nature of the provisions engendered by the new Act.
The concerns for indigent Nigerians still remains. How can this be eliminated? Remember,
the President, in his wisdom, said that the Act will cater for at least 83 million poor persons. Now, it is envisaged that even at the state level, the state governments should also be able to take a proportion of their very, very poorest of the poor and enroll them into the scheme. So it will be a collective responsibility, not just for the federal government, but for the states, even as well as local governments.
Finally, Dr. Okoro applauded the leadership of the NHIA for reforms and initiatives that are coming on board to make health insurance processes seamless.
It is on record, and I stand to be proven wrong, that this present management led by Professor Nasir Mohammed Sambo has introduced initiatives that are far-reaching and fundamental. Look at the strategic plan, 10-year strategic plan. It wasn't there before. Some of us in the states were now keen into that to domesticate it and produce our own state plans. There are several, look at the drug initiative, as well as look at the ENHIS. So there are several other areas that this present administration of NHIA has made taking profound steps. And I hope that these steps will be seen to their logical conclusion. And we are ready to cooperate with him to achieve that.
That was Dr. John Okoro sharing his views on the new NHIA Act and the operations of health insurance at large. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Question: does NHIA cover delivery commodities?
NHS, when we talk about delivery, what NHS does is that there's a difference, a little difference, or when you say the word commodities of a wider range. So what NHS does is that it covers all the drugs and also the consumables. The word consumables are the ones that are more of medically related. Things like syringe and needles, things like gauze that they use during the delivery, things like cotton wool, and things like sutures that they use for suturing during the process. But other commodities like soap, like sanitary pad, like the diaper pack that they use to clean the baby, such type of commodities are not covered under the scheme. So I think the enrollees or our mothers that are going, that is to the maternity area, should get this thing clear, that it is only the consumables that are being covered.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Here we draw the curtains on this week's episode of the program. National Health Insurance Authority is leaving no stone unturned to see that it fulfills its mandate to Nigerians. Join us every week as we continue to bring you updates on more of its activities and strategies as it marches towards universal health coverage. See you next week.